this is actually very exciting because I never get to interview anybody, and you only interview people. So I feel like this is some sort of weird, other world in which we have flipped roles. So for this day, I get to play the interviewee.
The black hole of interviewing. I just want to say, I think I like the term competitive interviewing that we used earlier today. I think this is going to be a competitive interview because I am wholly uncomfortable with the idea of being interviewed. So everything you ask, I'm coming right back at you.
I know it's going to be good. It's good for you. It's actually good for me, but better for you. So we're going to start. So my and already kind of failing as an interviewer, you're not supposed to say my first question is, but I'm going to say my first question. So as you may remember, I was a soccer coach for both of my sons and basketball coach, but soccer coach for both of them when they were younger. And if you've ever watched, particularly when they're 5 and 6 year old, that's when you're playing 3v3. And watching 3v3 5 or 6 year old soccer is not really the most exciting thing. And so one thing you may remember is, or somebody would always ask me, well, how can you tell if one of these kids is eventually going to be a really good soccer player? And I would say it's the kid who understands spacing, because in 6 year old soccer, they all bunch up. If the ball's over in the left corner, everybody's in the left corner. And it's like the one kid who figures out he can get into space, and eventually that ball will squeak out and he can take off and score. That was like the smartest kid or best kid. But anyway, so my question for you is this: if you're in the context of that bunching in soccer, it feels to me like there is just everywhere I turn in healthcare conversations, there are discussions about behavioral health, this, behavioral health that, mental health solutions, services, and everybody's kind of talking about it. And what I'm wondering, which is probably a little bit heresy for the event that we're taking part of, is like this.
Thank you, Salome.
Why does behavioral, is this just like a bunch of people bunching around the ball? Is this sort of like other things, social determinant of health, whatever is the sort of hot thing of the moment? Why does it matter? Why does it actually matter now? Is it a real thing we should be focusing on? We got a lot of diabetics, we got people with cancer, we got people with heart disease. Like, shouldn't we be focusing on them? Why are we focusing on behavioral health?
So one of these, you and I have joked about this through the years, we would also call it the run to the light syndrome, right? There is something, healthcare gets a bee in its bonnet, it gets all excited about this or that, and then everything else, like, run to the light, this will save us. And you just know that if you wait long enough, there'll be a new light and people will run to that light, and this poor little thing will get in trouble and not be in favor anymore. I actually think that's not the case for behavioral health. And I love that I get to do this interview with you, Marcus, because I have known you forever and I love you deeply. The very first time that we really became friends, I would say, is we had been trying, as Eliza, this is way back in the day, to do something with you as Walmart. This was like 10 years ago. And literally more than 10 years ago, I went into a meeting with you and we were all ready to explain. We had already had 6 meetings with you at this point. We'd bring you these gorgeous ideas. We'd be like, Marcus, this is fantastic. This is something for diabetes. This is something for asthma or cardiovascular disease. And you'd always do the very polite equivalent of, you're so cute, thanks for those ideas. That is not of interest in any way, shape, or form to the X million number of uniques. I think it was 150 million uniques who walk through our door every single week. So thanks, no. And only the very first time that ever changed, we'd walk in and we talked about the unmentionables. And this notion that we have to expand the definition of health to include life, because when life goes wrong, health goes wrong. We talked about caregiver stress, financial stress, relationship stress, and workplace stress. And I remember you pushing back in the way that you do, and anyone who knows you, Marcus, knows this. And you're like, that's the first intelligent thing you've ever brought me. And you didn't mince words. You were like, that actually makes sense. And I think what you were getting at is because that is behavioral health. Because what we were talking about is the impact of real life on humans. And the impact of real life on humans is hard. And it expresses itself in things like anxiety, despair, loneliness, depression. Another topic that we've had for a long time is the notion of deaths of despair. Mm-hmm. And 2017, 2018, 2019, for the first time, the death rate in the US started climbing. And it started reversing years and years and years, decades of improvements. And it started climbing because of the increase in deaths of despair. I think it was actually 2016, 2017, 2018, 2019, it's been flat, maybe came down a little bit. I guarantee it's gonna rise again now. And deaths of despair, as we know, are from deaths related to alcohol, drug abuse, or suicide. And that is the underpinning of why this notion of behavioral health, I think, isn't going anywhere. And when you look at the challenges of COVID and what's going on in our country at this very moment with Black Lives Matter, we will absolutely, the opposite of the deaths of despair is connection, right? The opposite of this notion of, there's this great quote that I wanted to share with you from Johann Hari's new book. I'm guessing you read this already. I have not yet. Lost Connections. There's a quote in it, the opposite of addiction is connection. So what I want to argue is, I actually think if we say what light should we run to, and this is a light that's actually going to stay here, it'll be love. I think connection will save us. And I think connection is at the root of addressing behavioral health.
So you mentioned something going back on the unmentionables. One of the areas that was explored in the unmentionables was also caregivers and caregiving, and the perceived kind of stress and angst and challenges that caregivers face. But again, I'll sort of same kind of question as on behavioral health. Like, there seem to be lots and lots of conversations happening today around caregivers. And when I talk about caregivers, I mean, I know it's, in some ways that term has been a little bit, not usurped, but kind of broadened. You have caregivers who are physicians and nurse practitioners and nurses who are working. You have paid caregivers who are going to the home. I'm sort of more describing the unpaid caregivers, so those who are caring for an aging parent, or who has a health issue, or challenges a spouse who has a health issue, a child who has a health issue. Again, kind of similar to behavioral health, it feels like all of a sudden caregivers, unpaid caregivers, and sort of there's been a dialogue and conversation around them that's just sort of popped up. But we've had people who've been caring for aging parents for, centuries. And I guess the question is, even going back to the unmentionables, what is sort of, why are we focusing on them? Why are we focusing on them now?
I love that question. And I think I'll use an analogy back to Walmart. In the same way that Walmart, you can think of as sort of really a backbone to the essential infrastructure of the US, and we've certainly seen that play out in the last couple of months. Caregivers are an essential backbone to the economy, period, end of sentence. The value of the unpaid caregiver labor, and this was before COVID, and this is a 5-year-old number, was $490 billion. The most recent number is 53 million unpaid informal family caregivers in the US. Again, that was before COVID. And I would argue that the numbers have probably at least doubled. We at ARCHANGELS, we just fielded some research that looked specifically at what percentage of the US would now self-identify, would say, I am actually a caregiver, and that number is now 61%. And we asked a follow-up question, which is, okay, were you a caregiver before COVID, or are you new to caregiving? And 51% of the population said that they were new to caregiving. And I want to just go through a couple statistics around caregiving, because I think it matters so much. When most people think about a caregiver, a population thinks about exactly what you just described, which is the paid caregiver, right? It's the front line, it's the doctors, it's the techs, the nurses, the physical therapists, and that is true, and they are caregivers, and it's an incredibly important population. And I love all the efforts that people are going outside and clapping and recognizing this population. Less seen is another front line of care, which is the paid caregiver who might be a cashier at Walmart. It could be the postal worker. It's somebody who's delivering vital infrastructure support so that the economy could keep moving. And then there is this unpaid informal family caregiver, which I think has been the most invisible. And I think one of the reasons they're becoming visible right now is because the burden on them is so extraordinary to be handling the changes that are happening across the economy. And one of the things we used to love to joke about, but it's not a joke, but it is kind of a joke. I wish the unpaid informal family caregiver population would take a strike day. Be like, you know what, we strike, we're out. because it would literally bring the economy to its knees.
Mhm.
I want to share a couple other quick data points with you because I know you love data. So we use a metric we call high intensity for caregivers, much as we did in the olden days around the vulnerability index and the notion of, expand the definition of health to include life. How do we measure the impact of life on health? High intensity caregivers are 10 times as likely to have a clinically significant level of anxiety. They are 5 times as likely to report using alcohol as a coping factor. They are 10 times as likely to report that they expect their health will worsen in the next year, which is an incredibly important metric because humans are very good at predicting what's going to happen in their health, as it turns out. And caregivers are at high risk of being much less connected. Caregivers who are at high risk are much less connected to positive coping strategies like family, faith, and other caregivers. 32% less connected to family, 40% less to faith, and 45% less to other caregivers. So serious indications that this population is massive. We're not seeing it, we're not supporting it, and the impact for caregivers of behavioral health is, nearly immeasurably large.
Well, and also, I think there's a comment that if you listen to some of those facts, it also feels like it's a group that is inherently isolated as well. Maybe not sort of truly physically isolated, but sort of emotionally isolated, or they feel kind of isolated because of that burden they carry. So kind of, I guess with that point, then going back to it, this question of we started with is behavioral health kind of a fad? Is it a real thing? Is it something we should be focused on and committed to? Caregivers, same thing. Is this sort of is it the need to kind of focus on their needs? Is this a little bit faddish? I think what you've convinced me of is no. If you want to address core medical and healthcare needs, you better address behavioral needs. And fundamentally, if you believe that given this kind of size of the population, the challenges they face, and the impact on their own health, where I think you sort of allude to it, that the second you become a caregiver for an aging parent, for example, your own health is going to deteriorate faster than it may have been. Whatever the trajectory was, it's going to get because of that sort of burden. So walk me through a little bit more that intersection between behavioral health is something we need to focus on, and caregivers we need to focus on. How do we actually think about that intersection between behavioral health and caregivers? Because for me, when I think about behavioral health, honestly, I think a lot of the focus is on just generalized sort of mental health issues, stress, anxiety, depression. It's kind of core. A lot of behavioral health is also focused on that kind of smaller subset of individuals who have an underlying diagnosable clinical mental health illness. So clinical depression, schizophrenia, other things. I think a lot of behavioral health is around, as you describe, addiction support. So how do we deal with opioid crisis in America? How do we still deal with the fact that we've got, a lot of alcohol addiction and other sort of forms of substance abuse? How does that, but a lot of that is kind of generalized to the entire population. How is behavioral health for caregivers? Is it the need for behavioral health solutions the same, or is it different for caregivers? And what is it about, what do caregivers need from a behavioral health perspective?
So I would say, I think behavioral health and caregiving are inextricably linked.
Okay.
I think you can't tease the two out of each other. And I think that in a negative way and in a positive way, right? Because caregiving also can give you a lot of joy, it can give you a lot of purpose, it can give you a lot of fulfillment. It can also actually double your risk of coming down with a chronic condition, double your risk of depression. So we know that these two things move together. I want to use as a quick analogy the notion of the silos that you and I discussed before, which is, I think the way that the healthcare system is organized, the way that our country really is organized, is around this idea of this is financial services, and this is healthcare, and this is retail, and this is entertainment. And therefore, I'm going to service you, human, within the construct of this silo. If you think about what humans do, and this is why I think Walmart Health is so genius. That's not what humans do. Humans wake up in the morning and they're not like, this morning I'm going to focus on my, my financial services self. Second hour of my day will be my healthcare stuff. My third hour of the day, I will do my shopping. And then I will focus on my entertainment. Like, we just wake up and most of us are out of control from moment one. And that's particularly true for caregivers. Yep. And so I would actually argue caregiving is really the epicenter of life sucks disease. And you'll remember life sucks disease was the other term we would use for the unmentionables. Mm-hmm. So if you're a caregiver, it is likely you're also seeing huge corresponding magnifying negative effects in other aspects of your life, specifically your financial life, your relationship life, and your workplace life. We know the percentage of caregivers who are no longer able to do their job the way they could before, or even do it at all. The financial impact on caregivers is through the roof. What percentage of caregivers get a divorce? I can't even begin to imagine. I had 2 examples just yesterday of folks who came out of a caregiving situation and ended up getting divorced because of it. And so I think the question of what do we do to impact it is by addressing the holistic needs of the population. And the population includes a huge percentage of caregivers. And the needs of these caregivers, absolutely, if you back up to the core, reflect what behavioral health can do to address the negative impacts, but as importantly, to build towards the positive, to build toward the purpose and connection, peer-to-peer support, helping folks with loneliness, giving them practical, tactical tools in a way that is accessible, in a way that is affordable, in a way that helps them feel seen that they might not have been seen otherwise.
And so then take that. So I'm going to go back to the story you told in the beginning, which was how I'm a real pain in the tail to work with, and that you often will bring me great ideas and I shoot them down. But in my mind, I don't think I'm a pain in the tail. What I'm mostly interested in is I'm actually interested in things that work. I don't actually care about doing things that look pretty or feel wildly innovative or use the next greatest technology. I'm sort of using a behavioral health example from a number of years ago. This goes back probably more than a decade ago. Alex Hurd, the other Alex in my life, Alex Hurd, who you know, was working on a tobacco cessation program, and there was all these sort of big programs that got put in front of them that involved, call centers where nurses called and checked in on you every day, and it was, wildly labor intensive. And the irony in the end, the best solution that we ever saw was this simple bot-driven texting deal, which is just a robot would send a note to somebody in the morning, just to say, how are you feeling? And would sort of carry on what would be a very sort of basic dialogue with an individual. And for some reason, that was like a wildly successful way to engage people, to kind of, as if you were struggling, that was just sort of enough to kind of keep them going, to kind of nudge them to just keep going on. So I think about that a lot, which is, it's not always the hottest or sexiest or coolest thing, though the healthcare industry loves to do the sexy stuff, because you can talk about it, and you can get on stage and, as a health plan or as a health system or whoever, and sort of brag about you're working with the latest and greatest, but 99 times out of 100 doesn't actually really do anything. So I'm interested in this space. If what does good look like? What does getting it right look like? If I'm trying to address the behavioral health challenges that face caregivers, regardless of whether I'm a health plan or an employer, or I've got caregivers who work for me as associates, or I'm one of the blues and I've got caregivers in my plan, or I'm a health system who has caregivers sort of walking in the door, or I'm whatever it is. I'm a community leader. What does getting it right look like? What does good look like? What does that sort of optimal solution for caregivers from a behavioral health perspective look like?
Well, of course, I have to start by saying you're actually wonderful to work with, and I really do love you madly. And I want to thank you, because you being insistent upon us focusing on what mattered. Let's be clear, 50% of the US goes through Walmart every single week. And that gives you and they aren't often the 50% that we're necessarily interacting with in the leadership teams at some of these big health plans as an example. And I think that gives you a rawness. It gives you a consistent exposure to what is really waking most people up in the middle of the night. And that was fantastic feedback to us, because it helped us refocus on, if we really want to do what we're saying we're going to do, which is to help fix foundational health, what does that look like? And it looks like doing something that matters for real people in a sustainable and scalable way. So I do love you, as it turns out. And I like when you're mean to me, because that's why I became a cashier at Walmart, again, because you were mean to me. So I appreciate it. So what I'm going to frame it in a platform that we've been working on a lot, that I love, 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 love. With a caveat, I was on a call earlier today where it was about technology ostensibly. And I think there's technology can be a weapon or it can be a tool. And in the current world, I think often we identify a problem and then we look for a technology solution. And Molly Coy was on this call. I love Molly. And she said she did a beautiful job articulating what we learned at Eliza. It's really more that you have a problem and you look for a solution, and then you look at what things help feed that solution. And technology is an aspect, but so too are all these other aspects, right? So you shouldn't be technology in search of a problem. You should be a problem in search of solutions, for which technology is one. And that's true in behavioral health too. Let's never forget the value of human to human interactions. So the term that we use for our platform is look, love, lift. And it's very straightforward. It's the idea, and this is what I would say to the entire, population, whether you're an employer, whether you're a health plan, whether you are a social worker, whether you are a community YMCA in your community, we need to be looking for caregivers wherever we are, because they are everywhere and they don't look exactly like what we might expect. We know that 45% of caregivers are men. We know that 1 in 4 caregivers are millennial. We know that by the time you are a millennial, that split between male, female is 50-50. But that's not what most people think of, right? So let's expand our definition of what a caregiver is to be like, oh my God, caregivers everywhere. And then let's take a minute and recognize that what they are doing is love, right? And that we should be loving on them for it. And that last part is a lift. And the first notion of a lift could be something as straightforward as, when you see somebody's being a caregiver, that you say, thank you so much for what you're doing. I see you. And then there are so many other examples of lifts that you could do. Important in that first concept of looking at folks loving on the giving lift is changing the culture. We used to, around the caregiving space, say, hey, caregivers, you need to self-identify. And we did this too. At Archangel, we'd be like, we help caregivers self-identify. And then one day we realized, well, that's kind of mean of us, because that's putting yet another to-do list on the caregiver. The caregiver doesn't need more to do. Right. We need to flip that and say, our job is to help caregivers be seen. We need to create cultures and ecosystems and infrastructures that make it impossible for us not to see caregivers, not to look for them, love on them, and then lift them up. And that lifting up, in addition to the thank you, can also include things like connecting people to resources that exist. And those resources that exist can be things as straightforward as someone like them, right? So all employers should be putting together opportunities for caregivers to be seen, and then to find someone like them, because that other caregiver, that peer-to-peer support, is going to do a couple of things. First and foremost, it's going to help that individual, that caregiver, feel less alone. And caregivers often feel alone. Caregivers often feel shame. And we know that shame is just a conversation waiting to be had. And if we want to normalize the ecosystem, our country, and culture, if we change the conversation, we will change culture. So if we can get individuals to start talking about the fact that they're a caregiver, they'll be able to talk with each other. They'll both feel less alone. We know the power of that. And in the process, they will share tips with each other. Caregivers are really smart. Experienced caregivers have solved a lot of problems. Employers, by the way, caregivers are multitaskers. Any employer listening, hire as many caregivers as you can. They can get SHIT done. So I think that notion of, if you've got this peer-to-peer opportunity for folks, a lot of this stuff will take care of itself. And then there's the additional opportunity to actually connect them to resources that you, as whatever this entity is, has vetted, has curated, so that you know that it's actually valuable. So that could be, this could be where technology solutions come in. This is where, obviously, things that take tasks off a caregiver's plate, where caregivers really need is someone to take some of these tasks off their plate so they can get stuff done. And I think that notion of, in the process of actually connecting them, you're creating this time, you're creating this resource, gets us back to the last point. Another key thing that we can all be doing for caregivers is helping them get sleep. Because one of the things that caregivers really lack is sleep, and we know the impact that that has. So I want to share one other quick set of quick set of statistics. In our own data, we see a 62% increase in the likelihood of depression, anxiety, and stress when we compare people who've had negative sleep changes to those who had no changes at all. And for Gen X, it's even more pronounced with a 76% increase. For men, it's 75% of an increase versus for women, it's 56%. So both humongous numbers. In this case, again, bucking that perspective that's only for women. This is a huge issue for guys, manifesting in sleep. So help people sleep. Now, my last point is get folks a navigator. So get them a peer and get them a navigator. And that navigator is going to listen to their particular situation. They're going to know what resources exist within that organization, within that company, within that health plan, but they're also going to know the resources that exist across that community.
Yeah, and I want to maybe on that, I'm sort of mindful that there's this science that exists that looks at success. It's largely been around success of children. Why is this child successful and this other child maybe wasn't as successful? And it could be success meaning in grades. Success could be, down the road, are you successful getting a job that you make a lot of money? But success is also about, are you in a healthy, are you able to enter into and sustain healthy relationships? Or do you engage in community activities? Do you become a community leader, run for political office, join community organizations, support your church, those kind of things. So the definition of success is sort of broad, but the science behind it actually, what it shows is it's not that we're born special. It's not our genes or anything. That there are these attributes, and that the extent to which we as individuals and as groups sort of display these attributes are sort of critical in terms of they seem to have some strong connection to success of individuals, success of teams, success of communities. I say that all to say, so it's things like curiosity and grit and zest. But one of the 7 key attributes that, if you sort of look at it, is gratitude, right? And so when you think about how do you actually help, and one of the things I want to sort of call out as my sort of in comment here, that you talked about the work you've done with Archangels. What was interesting was that insight that we don't actually need more solutions. There are thousands, maybe tens of thousands of solutions, federal, state, community, even hyper local, school, church-based, whatever it might be, that and there actually was surprisingly a lot of money that was out there that could be kind of used to support individuals who are caring for particularly an aging parent in this case. But what we found was those resources weren't being used. And the issue wasn't that the need to go build more of those resources. The issue was, well, how do you actually connect the people who really need them with the people who have them, right? And the people who really need them, actually, as you were describing, what was interesting, sort of watching all the work you did, is how they didn't know about them. They felt sort of alone and isolated. And then I'm sort of struck by one of your points and the work you did with Archangels, and even seeing it sort of come to life in front of a cash register in a Walmart store in Massachusetts, of all kind of random places.
For 2660.
That's right. But seeing it come to life where this point of gratitude being critical and being a missing element in terms of, as you think about improving the addressing the stress and anxiety that a lot of these caregivers are facing, how do we actually have them understand that we're grateful for what they're doing, that we're all grateful for what we're all doing, right? And that if you remember, you're wearing those kind of early on, wearing those strange wings, and people would walk up to you and say, like, why are you wearing these wings? And you say, well, we're doing work to support caregivers, and you would ask them, are you caring for an aging parent? And a lot of people would say sheepishly, yes. And then you would look at them and say, we just want to thank you. You know, caregiving is, we believe caregivers are America's unsung heroes. And I can remember in a couple of those cases, I mean, people breaking down right there in front of you. And at first I thought, gosh, it's kind of odd, but I'm sort of struck by this reality that in many cases, it was probably the first time that anybody had shown any gratitude for the work they're doing. And so often I say the simplest things from a behavioral health perspective are the best. And so thank you for what you're doing, and keep it up, because we need it. We need more. And so thank you.
I love you madly, Marcus. And I think you epitomize, if you go back to Look, Love, Lift, you know, what we've learned over time around gratitude is if you give a lift, you get a lift. And there is nothing better for any of us. People say, write down 5 things every day you're grateful for. The only thing more powerful than that is write down 5 things you did today for which somebody else is grateful. Remind yourself to be giving, and be loving on one another in any way they can. So I'm so grateful to be here, and I love talking to you, and I would talk to you any day, all day.
Wonderful. Have a great day.